Everyone, today we're diving deep into a story that actually starts inside our own bodies. It's a story of rebellion, one that begins with just a single tiny cell. We're going to get right into the microscopic world of lung cancer.
So, to really get this, we've got to ask ourselves, what does a rebellion inside your body actually look like? What happens when our own cells just stop following the rules? It's a question that takes us right to the core of how life itself is built.
Okay, so our journey has to start at the cellular level. To really understand lung cancer, we need to shrink ourselves way down and see how this community of healthy, cooperative cells can get completely overthrown by a rebellion that starts from within.
Let's break down that really clinical definition, right? Malignant, that's just a fancy way of saying it's harmful and invasive. And uncontrolled cell growth, well, that's the heart of the rebellion. These are cells that have completely forgotten how to stop dividing, creating this chaotic, growing mass.
So how does a totally normal cell go rogue? Well, it usually starts with some kind of chronic injury, a lot of the time from toxins like smoke. This damages the cell's DNA. Now think of it like a car. The oncogenes, those are the parts that tell the cell to go, they get stuck in the on position. And at the same time, the tumor suppressor genes, the brakes, they just completely fail. And then that one broken down car starts making endless copies of itself, which leads to this massive pileup we call a tumor.
Now, while there are lots of different variations, this rebellion generally takes one of two major forms. About 85% of the time, it's something called non-small cell lung cancer, or NSCLC for short. It tends to grow a bit slower. The other 15%, that's the much more aggressive small cell lung cancer.
And if we zoom in on that more common non-small cell type, you see some really important differences. Adenocarcinoma often pops up in the outer parts of the lung. And here's a key point, it's the most common type found in non-smokers. Squamous cell carcinoma, on the other hand, has a super strong link to smoking and usually develops in the bigger central airways. Where the tumor is gives doctors vital clues.
For a while, this cellular rebellion can be completely silent. But eventually, as that tumor gets bigger, it starts sending out distress signals, actual warnings that the body can feel and hear.
Think of these as the body's alarm bells finally going off. A persistent cough or feeling short of breath happens because the tumor is physically blocking the lungs' airways. And if the cancer spreads, if it metastasizes, it can trigger symptoms in totally different places, like causing bone pain or headaches. These are absolutely critical signals that have to be investigated.
All right, so the alarm's been pulled, now the investigation begins. You can think of this phase like real detective work, where doctors are gathering all the evidence to create a map of the invasion, to understand exactly what they're up against.
And it's a very logical, step-by-step process. First, an X-ray or a CT scan might find a suspicious spot. Next, a biopsy is done to actually get a tiny piece of tissue. That confirms what type of cancer cell it is. But here's the real game changer in modern medicine: molecular testing. This is where scientists actually read the tumor's DNA to find its specific weaknesses, the genetic typos that we can now target with precision drugs.
All of that intel helps doctors figure out the cancer's stage. It's actually pretty straightforward. Stage 1, the cancer's small and it's just in the lung. Stages 2 and 3 mean it started to spread to nearby lymph nodes. And stage 4 means the rebellion has traveled to distant parts of the body. And this stage, it is the single most important factor for deciding on the battle plan.
And speaking of that battle plan, wow, has it evolved? We've moved so far beyond the old blunt instruments to what you can only really describe as precision strikes, designed to hit the cancer cells while trying to spare the healthy ones around them.
So the strategy is completely different depending on the stage. For early-stage cancer, the goal is an outright cure, and the main weapon is often surgery. But for advanced-stage cancer, the goal shifts to control. And here, the weapons are way more sophisticated. We've got targeted therapy, which attacks those specific mutations we talked about, and immunotherapy, which, and this is just fascinating, basically unleashes your body's own immune system to fight the cancer.
And this really brings us to the key that unlocks all of these amazing modern treatments. It all comes back to that molecular testing, that hunt for a specific genetic typo, a vulnerability in the cancer cell's own DNA.
Okay, here's a perfect example of how this works: the EGFR mutation. Think of this mutation as a unique lock on the surface of the cancer cell. If doctors find that specific lock, they can use a smart drug like osimertinib, which is like a key designed to fit only that lock. It goes in, turns the lock, and just shuts the cancer cell down. That right there is the power of personalized medicine.
Okay, so we've looked at how this rebellion starts, how we find it, and how we fight it. But the most powerful strategy of all is preventing the war from ever even beginning.
And the data on this is it's staggering. Somewhere between 85 and 90% of all lung cancer cases are directly linked to tobacco smoking. Things like air pollution and being exposed to toxins at work, like asbestos, make up a lot of the rest. The bottom line is, the main cause is environmental. It's about what we're breathing in.
And what that means is that some of the most effective solutions we have are at the policy level. Things like strict anti-tobacco laws, strong controls on air pollution, and rules to protect workers from harmful chemicals. These aren't just regulations. They are public health tools that can literally save millions of lives. And this is the most crucial point. And honestly, it's a really hopeful one. Lung cancer isn't just a matter of fate or bad luck. The vast majority of it is preventable.
And if you want a number to quantify that hope, get this. With effective smoking cessation programs and strong public health policies, we could prevent over 60% of all cases. Just think about that. That is a staggering number of lives that could be saved.
So this all leaves us with one big, critical question. Knowing that the causes are mostly environmental and that so many of the solutions are within our reach, how do we, together, build a future with cleaner air and healthier lungs? A future where this cellular rebellion becomes a much, much rarer story. Thanks for watching.